Hello, everyone. This is Dr. Mehta, and welcome to my YouTube channel. Today, we'll be talking about one of the most important and most common topic in healthcare, which is commonly ignored. And as you've seen from my past videos, my focus has been on insulin resistance. And in that series, today we are going to talk about how to identify this hidden enemy, because this particular disease can present with so many myriad signs and symptoms that it is impossible to recognize for lay patient, let alone physicians. I just recently saw a patient in my office who had multiple complaints similar to what I'm going to present today. And for every symptom, she had a diagnosis, which was a separate diagnosis. So she had close to about 7 or 8 diagnoses. She needed to see a specialist for each one of them. On further questioning, I figured out that most of her complaints were caused by only one condition. So today we're going to talk about it. So let's jump right in. So very first symptom of insulin resistance is brain fog. Um, so typically, brain fog can present as something like a cognitive impairment, which means that you're not able to think very clearly. um, you know something, you are quite familiar with that, but you cannot quite recall. uh, the patient become forgetful if presented with multiple questions. They are not able to comprehend or synthesize or analyze the situation. So these are very fine dysfunctioning of the executive function. And in today's society, everybody is very busy doing multiple things, work, family, social circle, and on top of that, all the distractions from the internet. So you really have to be working at a 400% of yourself, let alone 4%, and that is what the situation is uh, due to this particular problem. Now, it is very important for us to understand that why does this happen. Now, as you know, the brain exclusively works on glucose as well as ketones. And because the glucose is not able to enter into the brain cell because of insulin resistance, it lead to malfunctioning of the brain cells, which can result in this particular symptom called as brain fog. And frequently, it lead to frustration, anger, and reduced productivity. Um, the second symptom to discuss is on a lab testing. Some people have low testosterone, and symptom wise, they have erectile dysfunction. This is also related to insulin resistance, and the primary mechanism being the fat cell or the excess of it can convert the testosterone into the estrogen. There is also a reduced production of the testosterone, and both of them together can cause this condition, which is very frequently observed. And as you all know, that the brain fog and low testosterone, they have a separate medication for that. So you'll be surprised that for every symptom I will describe, you probably have been given a separate medication. So let's jump into the third symptom, which is the belly fat. Now, this is a very critical part of insulin resistance. It does not mean that anybody who does not have belly fat does not have insulin resistance. I have seen lots of patients who did not have any belly fat, but they did have quite significant insulin resistance, and part of that could be genetic rather than exclusively because of the uh, accumulation of the abdominal fat. Now, this excess accumulation of abdominal fat is caused by the excess glucose, which is not metabolized, is converted into fat, which is then deposited around the viscera, which are the internal organ, as well as the uh, around the abdominal muscle, leading to that appearance of belly fat. Now, this abnormal fat, and because it is at the wrong place, it acts abnormally. It is not connected to the body hormonal system, and it does what it want to. So it's basically autonomous entity which will release chemicals called as cytokines, which can create havocs in patient with insulin resistance, leading them to have multitude of problems ranging from joint pain to thrombus formation in their arteries to skin tag and so forth, and I'll go over them with you. The fourth condition is the swelling of the feet and water retention. This is also a very, very common feature of a patient with insulin resistance. This is also caused by the accumulation of the water due to the effect of insulin on the kidney function. The next symptom is the poor sleep quality. Now, this is also related to insulin resistance, and this is kind of one of those symptoms which lead to insulin resistance. So, insulin resistance causes poor sleep quality, which in turn lead to insulin resistance, and they go back and forth in a vicious cycle. Um, the next symptom is the hard to lose weight. Um, and this is a very, very common symptom. In fact, most of my patients who want to lose weight, typically this is their first symptom, that no matter what they do, they cannot lose weight. Part of that is um, the fat cell, which are there in the belly at the wrong place. It blocked the action of the insulin. So whatever that person eat, no matter how little he's eating, all of that is into saved as a fat, and that abnormal fat then will release more chemicals, which will block insulin even more, and this lead to a vicious cycle. Um, the way to understand insulin resistance is that this is a uh, body's response to lack of food. Many, many thousands of years ago, when humans were not developed, the food was scarce. We were like hunter gatherers, running around and trying to get something to eat, and it was very difficult. And body developed this mechanism where whatever food it will get, it will use some, but it'll save most of it for the rainy day, which were very common. But the society had changed. There's plenty of food, but we still maintain that genetic predisposition. It is more common in the society which were impoverished, third world countries. So those people are very prone to insulin resistance. particularly when they become more affluent or move to another country, just like they do when they come to America, not realizing that invariably 99% of them will develop insulin resistance due to very rapid weight gain and develop diabetes and other problem by the time they're 45 to 50. So this is a very common phenomena I see in my practice. The next symptom is, of course, sleep apnea, and as I mentioned, it is um, basically caused by hormonal imbalance and the poor functioning of the brain, which causes this condition. The next in line is, of course, the joint pain and inflammation. This is caused by the release of the cytokines by the fat cells, which then make people hurt. And this particular type of conundrum uh, will make that person less mobile and never get restful sleep or enough even rest. So lead to poor quality of life and poor productivity. The next symptom or the sign is the development of the skin tag, which are small overgrowth of the skin, typically found in the neck area, in the axilla or the axillary area. These are one of the very important signs of development of insulin resistance. If you notice them, talk to your doctor and get tested. The next in line is the development of the cyst, and this is very surprising to most people because they did not know the Baker's cyst is related to insulin resistance, and this is again caused by the inflammation which is created by the fat cells. The next in line is acanthosis nigricans, which is a dark velvety skin patches in the axillary area as well as the neck area, which are also a sign of insulin resistance. Then, a lot of folks with insulin resistance have a poor exercise capacity. They get tired very easily. They exercise for a few minutes and they need to take rest very frequently and not able to finish their workout. And this is caused by the lack of glucose being able to enter into the muscle cell. So muscle get tired very quickly as they're not getting their fuel, and this lead to exercise intolerance. The next in line is the carb craving. This is quite intense desire to eat something sweet, particularly after the meal. And no matter how much you eat, you still want to eat something sweet. And restaurants all over the world use this tactic to feed you some processed, overpriced junk food. Um, and this is caused by, again, body is not able to use glucose even though you had a meal, but the glucose in the meal is not able to be utilized, which lead to carb craving. So more you eat, more you want to eat. This is a never-ending desire. So be careful with that. The next in line, of course, is the not feeling full after meal. A lot of these folks, even if they had full meal, they do not stop eating, and this is very complex, phenomena. Is basically caused by the lack of satiety signals and hunger regulation, and this is the reason why the new GLP-1 analog like Ozempic and semaglutide have been so successful because they reset the hunger and the satiety signals, thereby limiting the food intake. And because of that, patients are very quickly able to lose weight. Semaglutide also affect the craving negatively, and this also lead to rapid weight loss. The semaglutide particularly goes after the fat as well as the muscle. So if you are on semaglutide, if you're not exercising, you're not losing any fat, but you're losing your muscles. So it is very important to exercise while you're taking the semaglutide, and you will lose the fat what you are supposed to lose. The next in line is the afternoon drowsiness and the fatigue. This is a very, very common symptom. Most people, after they eat their lunch, they feel sleepy, but after some time, they wake up and able to resume their work. This is also caused by lack of glucose being utilized by the brain, even though the person had a full meal. This can also be caused by the sudden increase in the sugar if that person is diabetic, particularly postprandial or the after meal condition. So be watchful of that. Even if your sugar is low or high, you will develop this symptom. PCOS is a very common condition associated and caused by insulin resistance, which is a common, very complex hormonal imbalance. Um, it's associated with menstrual irregularities, the excess testosterone, hirsutism, and infertility. This again very commonly associated with insulin resistance, and presence of this should alert to the doctor that this person may have insulin resistance, and they should treat them further. Hypertension, again, very common. Everybody assumes that by the time they are 40 or over 40, they will develop hypertension. Not really. They should not. The reason they develop hypertension is because of the insulin resistance, which causes fluid retention, which also causes increase in the blood sugar, and thereby making them develop this condition. The fatigue is a very, very common symptom. This fatigue is no matter how much the person rests, they're always tired. And this is again due to body's inability to use glucose, which lead to this condition. Um, as far as the management and prevention, the very first thing in management is to identify what it is. The physicians as well as patient need to be very watchful if they have the above mentioned signs and symptoms. That was my reason for presenting this, so that more and more people can identify this and request their physician to be tested for this. Now, a lot of my listeners live in other countries, India, Pakistan, Bangladesh, Indonesia. I have listeners in Australia, Britain, as well as America. And some places, the testing capacity for insulin resistance is available. What we do in our facility is called as NMR, liponuclear magnetic uh, resonance testing, and this will give us a score of the level of insulin resistance, and this will guide the physician in treating that patient accordingly. The second step, once you identify the patient has insulin resistance, is to look for ways to help them lose weight if they are overweight, um, control their diabetes better. Um, and as far as the weight loss is concerned, there are many ways to do that. And we have developed a system, and we have close to 500 patients in that program, uh, which is very successful. And I believe that since the program is very new and complex, which will be another topic for my next presentation. So I will first I will show you in my next video a couple of my patients whom I successfully treated with this approach, and I will discuss their lab result before treatment and after treatment, and also discuss their success stories. So I'm looking forward to bring you that next installment of our success. I also appreciate all of my listeners, viewers who have supported me. We have already crossed the 10,000 subscriber mark in little over a month, which kind of tells me that a lot of people are listening to this, which encouraged me to even reach out more and make more content available for my listeners. So, without much further ado, I will. I'm looking forward to discuss with you more in future. In the meantime, please continue to subscribe, like, and share my